Hi, everyone. Dave Griswold from Integrative Dry Needling. And I wanted to talk a little bit about lateral elbow tendinopathy, more from the lens of a chronic tendinopathy than acute, due to the changes in the pathophysiology that have important clinical implications for us, both within the examination as well as the treatment of chronic tendinopathy. So we look at the local pathophysiology. In chronic tendinopathy, really the role of inflammation is unclear. But there are structural changes that occur due to collagen breakdown that you can see visibly under ultrasound. There are also changes to microcirculation, so the blood supply in and around the tendon, as well as there are changes to the sensory nerves around the area of a tendinopathy that can lead to sensory gain, and that it can create mechanical hyperalgesia with use. In addition, you might find that individuals have developed myofascial trigger point down the extensor bulk. But the question is actually dysfunction of the muscle, or are you finding those because of an underlying nervous system pathology? So we think about nerve inflammation in tendinopathy. With lateral tendinopathy, we think about the radial nerve. So when you have inflammation of the radial nerve itself, you can actually see a more diffuse presentation of inflammation and temperature changes, as evident by thermography here. And so when that happens, you can see it follows specifically down the course of the radial nerve. So needling locally in chronic tendinopathy, you're missing part of the neurogenic inflammatory cascade that's probably driving some of the pain and mechanical hyperalgesia in that clinical situation. In addition to that, we know from different systematic reviews that there is evidence of both regional and widespread hyperalgesia in elbow tendinopathy. And so you can get central hypersensitivity both within the spinal cord itself, as well within the primary sensory and primary motor cortex of the brain. So when you address tendinopathies, it's great to needle it locally, right? There's been at least 2 systematic reviews that have shown that local tendon needling has a pain-reducing effect. But in addition to that, what we want to be able to address is the neurogenic inflammatory process of the radial nerve, as well as being able to reduce some of the central hypersensitivity through the use of electrical nerve stimulation. This way, you create both a local, segmental, and systemic effect to help optimize the outcome.